let me start off by saying how inspired I am. I'm inspired by this level of conversation. I'm inspired by the knowledge and the wealth of experience that is being shared today. So definitely, and even more in the sense of we know that there's people's lives that are being affected by this disease, and I think there is genuinely an impetus or desire to want to partner or wanting to do something different. So that's encouraging. I think that's really what we should be focusing on and seeing how we can materialize those conversations into something more concrete. Let me start off by first thanking ISNTD for organizing this event. Cameron, thank you so much for the professionality. I would use the term not so much seamless, I would use fluidity. You know, I think it's very, well, sorry, plasticity. Plasticity, I think it's been fantastic. And also, for Novartis, we're, let's see, oh, here we go. So for Novartis, we're really trying to focus on our mission of discovering new ways to improve person's lives and really extend those lives, right? We are really trying to go beyond what is expected of us as a pharmaceutical partner, and really not just focus on that manufacturing of medications, but really reimagine what good would look like or normal would look like. So really that's a large challenge that we are setting for ourselves. We took what we wanted to do here was a little bit give you an overview of what we're doing. Chagas is new for us. We have been working on some aspects of Chagas, but the way we came across Chagas, an opportunity for us to do something, was, as my colleague mentioned, the correlation we saw between heart failure and Chagas, and we are really in this session really to begin to try to get some fact-finding and really wanting to see what we can do. We are broken out into really three business units: innovative medicines, that is focused on pharmaceuticals side, as well as oncological solutions. Sandoz, we're the second largest pharmaceutical company in the world for generics, and Alcon, the number one ophthalmological company in the world. And so how do we reimagine medicine, right? How do we find new ways to fight diseases? How do we deliver new treatments? How do we operate? Really, it's through these kinds of sessions, these kinds of conversations, and making these conversations reality. And really, I think what we're seeing the challenge of Chagas is that it's not just companies. So it's no longer organizations. I think we really need a multi-group approach. The health systems are really a huge factor, and I think really putting ourselves in their shoes, it's so difficult to tackle, right? Healthcare systems are under huge pressure. How do they stay solvent with all these various challenges that they have? Tons of chronic diseases that are out there. How are they trying to juggle some of, for example, Latin America, the currency devaluations of many of the countries? How are they trying to diversify political challenges? So we really need to create a call to action, but something with a more comprehensive approach. The way the discussions that we've had, I see that there's an opportunity to maybe partner at a regional level for Latin America around Chagas, and I see something that's specific that's needed for the U.S., just because they're different kind of situations. But I definitely think it would be great to make that a little bit more clearer. Now, what I'm showing here is how do we begin to shift that dialogue? We need to do it with more tangible data, right? How do we begin to provide a little bit more context of what the problem might be? As we mentioned, our connection or how we came across the Chagas need was around heart failure. So we decided to commission what is the current situation of heart disease in Latin America. We commissioned 9 country studies around 4 diseases to understand, well, what are the costs around this? You know, what are the issues that we're having? And once we understand the situation, how do we begin to partner with health systems on solutions? These are really at a high level the figures. So heart disease prevalence for people that are 20 years and older, it's really, really high. In most of these countries, it's the number 1 cause of death for patients. But there's no plans, there's no governmental plans on how they're going to tackle this. Now, if we look at the financial burden, It's tremendous, truly, truly tremendous. So when we were having initial conversations on, well, we need medications, we need industry, it's not just that simple. I generally feel that the money is there. The governments do have the money. And I think if they don't have skin in the game, the commitment isn't there. We need that level of 360 kind of planning on how do we tackle this. I think industry and private industry, we have a role to play. And I feel my colleagues here from the industry, Bayer, GSK, kudos that we're beginning to have these kinds of conversations. But what we try to do here is what is currently happening. And then when we look at heart failure, heart failure is a huge component of this cause. And what we're finding is about 20% of that prevalence is Chagas. So Chagas is a huge component. If we're, as was mentioned earlier, there are current treatments out there that are in place, but we also need to focus on what are the causes of death. Causes of death being heart failure being one of the main ones. So we think there's certain things, there's definitely an opportunity of what we can do there. Here we just try to highlight, provide at a high level what this Chagas disease represents for Latin America, right? This is one of the, as was mentioned by the WHO, one of the 13 most neglected tropical diseases. So there's definitely stuff we can do. I don't want to really get so much into the figures here, but it's pretty astounding. The story is kind of grim. So I think we can't continue to try to find the same types of solutions to these types of problems. We recognize that the challenge is there. We need to think outside of the box. We need to think more collaboratively. This is not a concept of profitability for Novartis. We're not seeing this as a business unit or where we're going to sell additional treatments. I think we are really committed on how we can help. This is not solely an industry-related problem. We need the community. We need the different stakeholders that are willing to do this work. I was sharing with some colleagues during the break. I had a chance to visit a South American country, and I met a doctor who had Chagas for close to 20 years, never knew that he had Chagas. Sometimes we find that our medical professionals are supermen or superwomen, that they are invincible, and he thought that he had the disease but didn't really do anything about it, right? Now, he lived 20 years with this ailment, ended up having to have a heart transplant. He's basically the only transplant that has occurred from a Chagas patient. And I wonder, I mean, the burden to the system, the burden for himself, and he is supposed to be the example for patients. We have such opportunities. People don't know what Chagas is. A lot of people in Latin America are being identified because they go to donate blood. They get that blood donated, and then they realize, oh, I have Chagas. And even the intervention with these patients on, well, what is your disease? What can be done? Is quite, there's a lot of opportunities there. You have the disease for the rest of your life. There's nothing you can do about it. You're of low economic means, so too bad. There's a sexual stigma to it as well. We found that certain people, since it's diagnosed in blood banks, are like, oh, you're maybe promiscuous or something that's happened. That's how you've acquired Chagas, because they don't even know what Chagas is. I think there's just a huge opportunity for knowledge, disease awareness that we can be doing. Maybe this is something that we look into as a group. Maybe is ISNTD, maybe is NDI. Sorry, I'm DNDI. Apologies. So I genuinely feel that there's an opportunity there. I would love to see what can we do in collaboration with PAHO. Where does PAHO, being a reference institution for the region, where do they step in and help us to then create that connection with the local local federal governments in each one of these countries? But there's a lot of work we can do. We're here to help. We wanna try to do something different. So excited to talk with you further. Thank you.